Farsightedness wasn't always treated with glasses. It was treated like a mystery you could argue with, charm, or fix by hand. Long before anyone could measure vision with calm certainty, early doctors watched people squint at close things and called it a sign of misplaced sight, not a simple focusing problem. One writer might say the eyes were too lazy, another might blame misty spirits, and a third would insist the fault lived in the wrong part of the eye. So the remedies had to match the belief. Imagine an apothecary room lit by oil lamps, bundles of herbs tied with string, powders scraped onto small wooden spatulas, and steeping bowls bubbling as a healer explains that certain plants could clarify the lens of the soul. In some places, people also used herbal eye drops, medicated eye washes, and compresses soaked in bitter mixtures, rushed on with urgency, because if the mist couldn't be washed out, what could? Then comes the part that feels unbelievable, but has roots in real history. Some practitioners resorted to pressure, gentle at first, then more daring, using tools meant to reshape the eye's balance. A small device, padded and worked like a clamp, appears in descriptions alongside advice about where to press and how long, guided by the theory that vision was controlled by tension and order, not by light and focus. Even more startling, a few remedies mixed medicine with rituals, candles, prayers, and prescribed days to treat the condition at the right moment, as if timing could force the eye to cooperate. But medieval explanations don't line up neatly with what we understand today. Modern understanding says farsightedness is mostly about how the eye focuses near objects. Your close-up vision lands slightly off target. Back then, the same squint could be blamed on dryness, clouds, spirit imbalance, or a shifted inner balance. The result was a patchwork of treatments, herbs and washes, physical pressure devices, and belief-driven training, each one crafted to fight the exact story doctors told about what was happening. So when you see the old tools, powders, cloths, fitted pressure instruments, and stern instructions written like commands, ask yourself, which method offered relief, and which was just the era's best guess? Keep watching, because the deeper you go, the more you'll feel how desperately medicine tried to make sight obey, long before anyone had the idea of a simple corrective lens. Why vision problems confused early doctors. Long before clear spectacles became ordinary, farsightedness was often treated like a mystery fault in the eyes that could not be neatly explained. People would complain of blurred words at near distance, tired eyes, headaches, and difficulties sewing or reading by lamplight. Yet early doctors lacked a simple way to separate these complaints from other causes. Vision problems were discussed as if they were caused by shifting moods of the eye, dampness or dryness of the body, or the eye's failure to hold steady sight. Because symptoms overlapped with cataract-like clouding, muscle strain, and general sickness, doctors could easily connect the wrong dots. Medieval and earlier thinkers often pictured eyesight as a combination of what the eye gathered and what the mind interpreted, not as a fixed, light and focus process. Some beliefs treated clear seeing as something the body must actively draw in, while cloudy or strained seeing suggested imbalance rather than a mechanical mismatch. That confusion mattered. Farsightedness can feel like the world is fine from a distance, but refuses to cooperate up close. And early observers sometimes described this as a temporary failing of the eye's strength. When readers said letters slipped away during sustained work, it fit stories about fatigue, weak spirits, or crooked humors more easily than a focus-related explanation. As a result, treatment plans could be surprisingly varied and very physical. Some practitioners recommended warming or soothing approaches drawn from broader medical habits, such as soothing compresses and herbal preparations meant to calm the eye. Other guidance leaned toward cleansing or balancing the body, pairing eye complaints with recommendations about diet, sleep, and remedies to correct what they believed was internal. In households with chronic eye troubles, mixtures might be prepared from common garden herbs and applied externally as washes or drops, because if the eye was unhappy, calming it seemed logical. Tools were simple: cloths for compressing, small containers for rinsing, and metal or wooden implements used for careful application. Yet the goal was the same: change the eye's condition by changing the body around it. The most unsettling part was how beliefs could push doctors toward practices that were more about restoring balance than improving focusing. Some eye advice relied on the idea that sight could be diverted or repaired by changing pressure, encouraging the eye to behave differently during viewing. Herbal salves and oils were used with a conviction that the eye's surfaces could be persuaded to function properly again, even when the real issue was that near vision required extra focusing effort. Meanwhile, people sometimes blamed bad vision on the mind, stress, anger, grief, or moral imbalance. So remedies included calming routines and behavioral changes as if the eye were reacting to emotion. Modern understanding explains that farsightedness is commonly about how the eye focuses near objects, not about a temperamental or spiritually infected organ, but early doctors could not separate cause from symptom with the tools they had. Even surprising practices often followed the same reasoning path. If letters blur, then something must be wrong with the eye's surface, the body's condition, or the flow of sight. Herbal eye treatments and soothing compresses were not just superstition. They matched the lived experience of inflammation-like discomfort and the logic of the medical systems of the time. Yet the real mechanism behind farsightedness, extra effort needed for near tasks, could be misread as weakness, imbalance, or sickness that needed external correction. That's why confusion was so persistent. The results of up-close strain looked like disease, and without a clear explanation of how the eye forms images, early doctors often aimed their care at the wrong target. Strange methods used before eyeglasses. Farsightedness was long misunderstood, often treated as a moral or bodily imbalance rather than a simple mismatch between the eye's focusing needs. People could bring things near and strain hard, sometimes with headaches or watery eyes, and early healers interpreted that struggle as weakness, bad spirits, or a clogged flow of healing power. Even in careful medical writings, the story of clear vision wasn't always about the light itself. It was about what the body was doing. So treatment naturally drifted toward herbs, ritual, and mechanical training instead of lenses. Before glasses became common, strange methods aimed to teach the eyes to behave. Some practitioners advised warm compresses and rubbing the face around the eyes, believing that heat could loosen thick humors that were keeping sight from working smoothly. Others prescribed herbal eye washes, typically made from plants with soothing reputations, used to calm irritation and open the passage of sight. There were also home remedies that combined household substances into pastes or drops, applied with cloth or small swabs, relying on the idea that purity or strength in the mixture would travel straight into the eyes. The suspense here is that the relief some people felt, less burning, fewer aches, clearer comfort at distance, could be mistaken for a cure, even when the real issue was simply that near focusing demanded more effort than the eye could manage. Mechanical tricks were equally surprising, and they often made sense inside the beliefs of the time. Vision was treated like a skill that could be tuned, so some people used small devices meant to block glare or change how the light entered the eye, hoping the world would become easier to see. You can find accounts of pinhole-style approaches in the broader history of optical thinking. Restricting the incoming light can reduce blur, which can temporarily improve near clarity for some kinds of refractive trouble. Early practitioners also encouraged exercises, staring into patterned surfaces, shifting gaze between far and near targets, and repeating focusing tasks, because the theory said the eye needed strengthening rather than adjustment. Compared with modern understanding, the key difference is that today we explain farsightedness as a vision condition where close work requires extra focusing strain, not a substance stuck in the eye or a hidden imbalance that herbs can dissolve. Beliefs about eyesight shaped how seriously healers pursued fixes and how cautiously they judged results. When a patient improved after rest, better lighting, or reduced strain, common outcomes for any eye condition, records could interpret it as proof that the chosen method worked, even if the improvement was temporary or situational. Some medieval ideas treated the quality of vision as something governed by bodily fluids and the temperament of the person, so a near-muddled view could be framed as evidence of excess, dryness, or imbalance. Modern understanding is more careful. Farsightedness is about how the eye focuses light for close tasks, and it often feels worse with fatigue, poor lighting, or long reading. The old methods, meanwhile, were built around removing obstructions, calming the eye's state, or forcing adaptation, which explains why treatments could look dramatic: herb rituals, warming and rubbing, and early light-blocking tricks, yet still fail to truly address the underlying cause. A particularly telling pattern appears when you track how people responded to the first widespread use of corrective lenses. Once simple reading help became available, many people found that the same strain and discomfort faded quickly, without the need for repeated herbal applications or relentless exercises. That contrast helps explain why earlier approaches could feel so convincing. They sometimes reduced irritation, and the human body can settle when stressed, but the visual focusing demand remained. In the end, the strangest part of the pre-glasses era isn't that treatments were unusual. It's that they were guided by sincere beliefs about what sight was made of, turning farsightedness into a mystery of humors, heat, and light entry, rather than a straightforward need for optical correction. When the first real vision solutions appeared, farsightedness was often misunderstood in early medicine, treated less like a simple focusing problem and more like a warning sign that the eye was misbehaving or the body's balance had slipped. Many people did not think of vision as something that could be corrected with a tool. Instead, they believed the sight itself was being influenced by heat, humors, spirits, or even the way the eyes were trained by daily habits. That belief shaped what doctors did when the first truly practical vision solutions began to appear, because fixing eyesight meant changing the eye's condition, or changing the person's story about what the eye was doing. As clearer ideas slowly spread, early practitioners started to notice a pattern that sounds familiar now. Some people could see far away reasonably well, yet struggle with tasks up close, and their eyes would tire quickly. Instead of calling it a focusing mismatch, they described symptoms in vivid, everyday terms: burning, heaviness, tears, headaches, and the sense that letters slipped away when the strain set in. Suspense followed every attempt at relief. If an herbal wash soothed the surface of the eye, the patient might feel better briefly, and the doctor could claim the right remedy had been found, even if the deeper problem remained. If improvement didn't last, the cause was blamed on hidden impurities, an imbalance returning, or a wrong guess about what the eyes needed. Before glasses became a normal answer, treatment leaned on visible rituals and tactile tools. Some practitioners used herbal preparations made for the eye. Think soothing plant mixtures and compresses meant to calm irritation and strengthen sight through the skin and tissues around the eyes. There were also practices that involved careful pressure or massage around the brow and temples, based on the belief that the eyes were connected to the head's inner balance. Doctors sometimes advised strict changes in daily behavior: rest from close work, controlled lighting, and exercises that encouraged the eyes to learn to cooperate, because the era's logic treated vision trouble as training and temperament, not a mechanical mismatch of how the eye handles near tasks. The surprising part is how quickly people could shift from cure to certainty without real proof. Once lenses, small, crafted pieces of glass or crystal, appeared as a practical way to help near seeing, the effect could be undeniable in a way remedies rarely managed. A magnifying view could make letters steady, and that immediate relief was persuasive even to those who kept their older beliefs about humors and spirit currents. Yet many early lens users still carried medieval theories alongside the new help. They might say the glass brought the sight back, as if it corrected a disturbed balance, rather than simply adjusting how light reached the eye. Even when the new tool worked, the explanation often stayed half old, half new. Modern understanding is careful and different. Farsightedness generally means the eye does not focus close objects as easily, so effort builds, and the eyes fatigue, sometimes relieved by appropriate corrective lenses. Early medicine, by contrast, often blamed the trouble on dryness, swelling of invisible pathways, sticky humors, or weak eye strength, then tried to remedy the symptoms or the perceived cause around the eye rather than the focusing behavior itself. Still, the moment the first reliable lens-based solutions began to circulate, curiosity turned into a test. People who had suffered through strain could suddenly compare. Without the lens, close work wavered. With it, it held. That contrast was the true turning point. Less about adopting a new theory overnight, more about watching the body respond to a tool and realizing that eyesight might be corrected in a way no herb compress, or calming prayer could fully mimic. Before glasses became common, farsightedness was often treated like a mystery of the eye's spirit or strength, not a simple focusing problem. In old medical writings, people who struggled to read close-up were sometimes blamed for weakness, bad habits, even an imbalance in the body, so the cure could look wildly different depending on who was advising the patient. You're left with the strange truth. Many medieval and early medicine ideas about eyesight were both imaginative and incomplete. Some thinkers believed the eye was taking in the world in a certain way and that they fit between the eye and what you see could be fixed with lifestyle, heat, or cleansing. Others claimed certain humors, body moods imagined as fluids, made vision drift. Modern understanding explains farsightedness more plainly. The eye and its focusing power don't quite bring near objects into clear focus, so close work feels blurry or straining. That's the steady truth beneath the chaos. But history shows why people once tried such dramatic fixes. In the final moments of our journey, you see the most surprising practices up close. Herbal mixtures rubbed around the eyes with cloth or fingertips, warming compresses meant to encourage clear sight, strange little tools brought near the face to test how the eye responded to light, pressure, or different distances. Some practitioners even recommended watching carefully measured patterns of light and shadow, as if the right viewing ritual could retrain the eye. And though these methods weren't designed with today's knowledge, they were not random for the time. Each treatment came from genuine observation, belief, and hope, often mixed together in the dark before modern optics. Now the suspense lands on you. If old doctors could see symptoms clearly, blurry near vision, squinting, eye strain, why did the cures miss the real cause? The answer is that they were working with explanations that sounded believable, but didn't match how focusing actually works. Glasses didn't just offer comfort. They offered an honest shortcut, a lens that changes how light enters the eye so near tasks snap into place. So as the story closes, take a moment to look back at what you've learned. Farsightedness wasn't made up, it was misunderstood. The past tried herbs, heat, rituals, and even daring tools to fix the problem from the outside, and modern science finally gave the simple, reliable solution. If you felt that twist, history trying to cure what it couldn't fully explain, stick around. Next, we'll dig into the next set of medical miracles from the same era. Treatments so bold they sound impossible today, yet reveal exactly how people searched for truth when the eye was still a riddle.